Okay, now we've got it. So let me just start over. And welcome everyone to the event tonight. The title of our event is called Innovations in Community Care, and it's a 10-week series of brief talks on important topics in community medicine. My name is Dr. Lawrence LeBeau. I'm the program director for the Wright Center for Graduate Medical Education National Family Medicine Residency Program that organized this event. The speakers you hear from each week in the series, and tonight's the fourth week in our 10-week series, they're all faculty members from one of our training sites. And I always have to say one of our training sites because our program is the only national consortium of teaching health centers that have come together to form one ACGME accredited family medicine residency program with osteopathic recognition. And it operates as a single program with training locations in 4 different states. Our community health center partners are El Rio Health in Tucson, Arizona, HealthSource of Ohio in Hillsboro, Ohio, HealthPoint in Auburn, Washington, and Unity Healthcare in Washington, D.C. If you're a student that's joining us tonight and you're considering applying for a family medicine residency, we would love to meet with you afterwards and answer any questions that you have. Anyone else is welcome to stick around as well to ask any general questions about our program or our structure. Excuse me, we have some faculty and we might even have some residents by the time we're through. Join us from our program sites that'll be available after this talk. But recognizing that everyone's time is valuable, we want to keep each talk in this series both high value and as brief as possible and to the point. So with that brief introduction, I'm going to hand things over to Dr. Darlene Lawrence from our Unity Healthcare Community Health Center partner site in Washington, D.C. for her presentation tonight on lifestyle management through group visits. Dr. Lawrence, take it away.
Thank you. So good evening, everyone, and welcome again. Coming from DC, the hurricane is moving its way up through us, but it's going to stay around for a minute and give us a little rain. So we're in today. I think everybody can see the screen, and today I'll be talking about a program that we developed here at Unity from a national program called We Can, which is a health and lifestyle management program for, it originally started for obese kids, and it developed and we altered it and moved it along so that we can manage adults who have problems with their weight and pre-diabetes and diabetes and mobility issues. And it is called We Will. Right now it's on Zoom. It's at Unity at Parkside, my main site, and it's on Thursdays from 1 to 2:30 p.m. on Zoom. And it has actually open access. So We Will and We Will by Zoom, bringing lifestyle management to the community. So let's start with how it got to be Zoom rather than in the office. And this is just a video that actually was on ABC networks after we moved from in person to the pandemic making us go in the office. What are you doing? Anyway, it just played. Okay. Dwayne, why it won't play? It played earlier.
It seems to be the night for technical difficulties.
It played earlier.
Perhaps you can copy and paste the link into a browser.
I can play that. I can play it later. It just gives you everything. You say take the link and do what?
So if you stop sharing and you copy and paste that link into a browser window, you could play it from the browser window instead of from the Google Slides presentation.
Oh, because it's Google Slides. It's PowerPoint.
Whether it's Google Slides or PowerPoint, but it's just it's not playing from that platform. So if you open up a browser window and then share, making sure you share the computer audio and video button, and then it should work pretty well.
Okay, put it into a browser, you said. I'm trying to see what I need to do. Help me, help me, help me. Close that, close that, close that. And copy it copy the link. Now get out of that and then go to here, share the screen, share the sound, come back to here. Give me a thing. Nope. Okay, I have no idea. I'm sort of upset, but I'm gonna calm down and I'm going to talk about it. Okay. So where am I? I'm right here. Okay. So it's a video that talks about how we moved from the closure of so many in-person visits and things at health centers immediately to telemedicine at Unity within 1 week of the shutdown in March and April of 2020. And then how we really within 3 weeks, I was able to have my in-office sessions for this group class that reaches the community for lifestyle management placed onto Zoom. And the way that that happened so quickly was because at the Wright Center at our National Family Medicine residency, we do our didactics by Zoom already. So for the past 4 years, we were on didactics every week with our residents because it's a national program that was in at 1.6 sites and now at 4 sites. And so it was a very simple transition from in the office to giving the information for the patients so that they could continue with this lifestyle management class online. And so it really worked well for them. And it made it so that even when I was away, once we were able to travel again and I was away, Thursday afternoons from 1 to 2:30, I was on Zoom. And that meant even on Thanksgiving, I was showing them my Thanksgiving preparation in a healthy way. And even on Christmas Eve, we had a little party on the Zoom for We Will. So I've really only missed like 2 classes over the past 19 months of We Will. And that's when I actually had a surgery. So it's really been awesome. Okay, so let's go back to here. So who should come to We Will? Well, patients with diabetes, prediabetes, and elevated BMI, patients with elevated BMI, obesity, morbid obesity, which are all 3 different actual assessment codes, patients with mobility issues like osteoarthritis, and patients with food insecurity, because my program is also linked to some food resources for them in the community. And how do they get to We Will? They're referred by their primary care physician, referred by care coordinators or nurse care managers, or even social workers. So at our program, they should have a referral, but if they come to the class, I'm not sending them out. I'll just send a message to someone to ask for a referral after the fact. What is the itinerary for We Will? When they come in to the class, either in person, which they're really clamoring to get back, but when they come into the Zoom, we have the first 10 minutes for those who are logging in and getting signed on, getting their sound right. We have welcome and community engagement. The folks talk to each other, they find out how their weekend was previously, how they're doing in their steps. We all wear pedometers. Then we have announcements and special events and challenges for the month. So every month we have a new challenge, and every month I tell them about the special days of the month, what this month is special for, and what special weeks are there. So they all knew that in August they had the chance in that 1 month to have a mini banana split, because August is National Banana Split Month. in addition to a lot of other months, immunization awareness and things like that. So I like to go to the websites that look at special days, and I put that in there for them. We also report out on the board in person or on the chat in Zoom on the steps from the pedometer for the previous week. We keep that running every week. Then there's time for group exercise. It's usually between 15 and 30 minutes. I exercise with them, which makes it medical provider assisted and led exercise. That's an important billing code. I also, after the exercise, we take a fellowship break. Then there's a nutrition lesson, a healthy recipe preparation and tasting. I mean, like Rachel Ray, I'm in the kitchen cooking. And in the summer, usually I'm at a table with prep, showing them a recipe. And then I taste it and I eat it. And then there is a mindfulness minute, which comes under behavioral counseling. And then we have our farewell. And if the patients need it, I have time for them to have individual consultations as needed as we log off. So it's a 90-minute session every week, and it counts for intensive therapy for the patients. These are some of the month-long celebrations that we had for August. The International Clown Week, we made everyone say whether they were afraid of clowns or not. The national days. And so that's the kind of things I show them. We have our walking. The challenges that are ongoing are the walking 10,000 steps a day, drinking from your gallon jug each day. We've all taken jugs and decorated them and marked them off so that they fill up their jug in the morning and they drink from it all through the day. Getting restful sleep 5 or more hours. And that's really important because the older folks who are in the class, they're not going to sleep 8 hours. And you can't make someone sleep 8 hours. Kids need 8 hours and 9 and 10. But older folks, if they are getting a good restful sleep, they are great. Mindful meditations at least once a day. They have plenty in their arsenal because we do different ones every week. And finding time to play at least once a week. Then the special August challenges this month were to eat a different cuisine every week and stomach crunches. That was our target. So we started with either 10 or 20 a day, depending upon your experience, and increased that by 10 or 20 every week with a goal of 100 crunches a day by the end of the month. And about, I think 4 of them reached that, including me. After we do that, we have our exercise, like I said, and these are some of the exercises that we will do. All of these links I have sent the patients at different times in our text group. If they like the exercise that we do, then I send them the link in their phone so that they can reach it anytime. Some of these exercises are available through AARP member website, so they aren't eligible for them. So I send them to them. One of their favorite groups is the Walk with Nick. For 15 minutes, you can do a mile, and the chair workouts with Donovan Green. He really kicks your butt. After the exercise, when I'm taking a water break and I tell them to take a water break, we have developed that into their little fellowship time. They do a COVID check-in, social check-in, food resources where they share with each other, activities that they've done over the weekend, holidays, and current events. When we come back, then there's a nutrition lesson. This is one of the areas where the resident, if there's a medical resident who's on rotation with me, they will either present the nutrition lesson, the exercise, or the mindfulness. But most of them pick the nutrition lesson because it's closest to medicine for them. They can't get away from the medicine yet. So these are some of the topics that we've had in the past, but we've had at least nearly 100 topics because I've been having the program for 3 years. And these are some of the recipes. The most recent one in August was air fried corn on the cob with assorted toppings. My goodness, was it good? I just saw the recipe and made it. I have a new air fryer and I'm trying to use it for lots of things. And so that was really nice. But the recipes, I make it, they see it. I have a setup with my cell phone that has the camera on it, and I'm on the Zoom. And so I have it set up so that they can see what I'm doing. Sometimes I'm in the kitchen and then I use a phone stand, but they get to see everything. If I have something frozen, then I'm making some the night before, so it is frozen. And then I make it then to show them how to make it, and then I eat it. They're really jealous that they're not getting to eat it right now, because when we're in class in person, I cook for them. When we make a recipe, I like for them to go through their recipe nutrition fact checker to see, did we check off the areas that we know are important for them to have good nutrition. And the most important one is at the bottom, the deliciousness. If you got to have 3 check marks for that, or else the recipe has failed. For our minute mindfulness, this actually became a part of the program from the residency that we had, because we added mindfulness to our residency didactics. And so I do a lot of mimicking of what I'm teaching, what we're teaching with the residents. I do the same thing with my patients and vice versa. So we have lots of things that we've done. We do yoga right now. For August, we were doing yoga. So we had as small as 3-minute yoga all the way up to 15-minute yoga, which was a really difficult one, but we really ended up liking the Mayochi office yoga. He has 3 different ones that are done from a chair, and it looks like he's in an office on the beach. They really like that. But we've also had rain meditations and pace breathing and things like that. So after the meditation, they always want to come back and say how they liked it and whether they thought it made a change to their life or to their sleep. We've had mini naps where we've taken 5 minutes to actually find ourselves going into a sleep. We've had pace breathing, and we've had body scans, even meditations where I will go outside in the yard and they will go outside in their yard if they can, and we're listening to the sounds outside. So it's been really innovative and wonderful to be able to work with them. The lifestyle management is good for the patients, it's good for the doctors, and it's good for the community. We have scheduling. This is what's important for those who are looking at, how does she get to do this? Well, this was my schedule when I had the We Will. The We Will are the vertical lines. And so I really only see patients 4 sessions in a week. This is a week. So this is pre-pandemic. And those We Will patients, they were coming in. So then if you look at it and expand that one day, they all had the same amount of time. So that's why they didn't stack. And then post-pandemic, once we got into the pandemic, I went down and they took one of my days, and now on Mondays, that blue is all telemedicine visits. And then the Thursday counts as telemedicine also. The Tuesday is the only day that I'm in the office now. And so if you expand that out, you can see that it's the same amount of time, and I still have room for up to 15 patients then. And I'm one of the very few whose schedule never stopped during the pandemic. For the billing, I hope that this is small enough that you can't see it well, but under procedure codes is the important part, because we've been trying to figure out how to charge for this rather than just making it a regular visit, because in the FQHC system, the federally qualified healthcare system, billing is really very limited to 1 or 2 codes for an office visit. But because this is a group visit and it's doctor-led, not led by a health educator, I get to use codes that are doctor codes for giving this type of information. So the health behavioral intervention group, first 30 minutes, that code, therapeutic exercises, if it's led by a doctor, medical nutrition, if it's led by a doctor, or intensive behavioral therapy for obesity, are codes that can be used by doctors when they're doing group visits, and you get paid in addition to what you would get paid 2 different amounts for having a Medicaid type visit in a federally qualified healthcare center. The average encounter for 90 minutes with behavioral intervention is $340, and it's being paid because this is in addition to a regular visit for them. So it's, once again, good for the patients, good for the physician, and good for the community. And that's all I wanted to talk about for that, because I want to leave some time for questions.
Dr. Lawrence, I had a question.
Please, Valerie. Is that Valerie? No, that's Sharon. Please, Sharon.
Yes, it's Sharon Obadia. I'm from ATSU Soma, and I
Yay.
really appreciate your talk. And I really can tell how much you love this program. I just wondered, does Unity provide the pedometers for the patients, and how many patients are generally in one Zoom session?
Very good questions. So Unity had pedometers, and they had those divided plates for meal planning, and they had cups, and they had lots of those equipment and promotional. They were really promotional items. When We Can, the program for the kids, was in more of our sites, and basically I used them all up. And so now what I've done is, if someone cannot manage their app on their phone to do pedometer, then I found some pedometers at the Aldi that were down to $3, and I have a stash of them, and then I just got reimbursed for them. So basically they provided, but I'm now buying it. I'm not ordering it in bulk. So that's the first one. But they did provide it, and I have a budget, which is amazing, because some of the other docs who run the We Can programs at the other sites, they've not been successful in getting a budget. I don't know if I was grandfathered because I've been at Unity for 11 years and I've been doing this, but I keep telling them how to just put in for a budget. There is budget money for us to serve the community this way. The number of people in the class, when we were in person, it would be between the low around 6 and the high around 12 when it was in person, because it was linked to a food sourcing program. If you came to We Will, you would get produce RX, produce prescriptions that you could use at the local farmers market to get fresh produce. And they would come through, and during the summer, you might get a total of 30 individual new patients, but the average per class was usually around 8. But on Zoom, when I first started, we were at around 8. Then we went up to 10, and now we're really stable at around 6. Those 6 come no matter what, and then you have the travelers in and out that are another 6 or so. I really wanted to increase I think that even though it's on Zoom, I'm not getting the patients at other sites to log in. They can log in. So I put out recommendations and notice once a month at our all staff meetings or all provider meetings that there is Zoom We Will going on.
Thank you. It's such an amazing program. And I also wondered, are you going to make TikTok videos of your cooking?
My kids told me that I should not do TikTok because I'm too animated. They said I should do the Facebook videos or the YouTube videos.
I'll look out for you.
Yeah, I have to
Thank
do
you
something.
so much.
I love it.
Yes. Thank you.
Were there any other questions?
Yes, Dr. Lawrence, there's a question in the chat box.
Okay, let me look.
Wondering why you chose obesity as a target population.
Okay, so actually diabetes is the target population, and it's a program that's actually developed. It was developed through a grant from the NIH for reducing the incidence of diabetes in kids. And the biggest group of kids who were at risk for diabetes was kids with elevated BMIs and obesity. So it went from there to patients who had diabetes. But we had so many people who were interested in coming and they didn't have diabetes. So then I opened it up to pre-diabetes. And then there were folks who wanted to come who didn't have pre-diabetes. So I opened it up to if you had obesity. The last one that I added was mobility issues, because there's folks who want to come and get this lifestyle management. They want to know about the nutrition. They want to have a way to have accountability for exercise and accountability for mindfulness. They love the mindfulness and to have community engagement, but they didn't have diabetes. And so they all can come. So I really don't have any requirements. You just have to have a referral in order for us to get paid for the visit. But obesity wasn't the target. It's just unfortunate that obesity is attached to prediabetes and diabetes too much in the African American population.
That makes perfect sense. Thank you so much for answering that.
Sure. That was Pratik.
Yes.
Thank you. I wish I could put the link to the video. This is the second time that video didn't work, and it worked perfect earlier, but it's cute. I don't even know whether Dr. LeBeau has seen the video.
I don't think so. If you send me the link, I can put it in the chat box.
I know you were telling me to do something with the link before. I wasn't being very savvy, was I?
Yeah. I did just put in the chat box the link. So just as a reminder, all of our sessions are recorded and available for viewing afterwards on the Wright Center for Community Health YouTube channel. And I just put the link for that in the chat box.
Oh, you know what? I think I can, if I look at the YouTube video, I can put see link below. I can, add a link there too,
Okay.
can't I? I think so. I've been trying to learn. I've not been trying. I've been learning about YouTube, how to use it better.
Any other questions for Dr. Lawrence right now on lifestyle management through group visits?
It's a great way to reach, to be a source in your community. There's actually a patient I have who has behavioral health issues and goes to a community center on a weekly basis for counseling and community engagement. And his director reached out to me to ask me to come do a presentation on healthy living to that community group, because the patient talked about We Will all the time. And so we made a connection, and I've presented twice to that community connections group. So that was really nice.
Hi, if I may ask a question.
Sure.
Yes, so the patients that are referred, like, do they have to have like certain number of sessions, or they just can be there for a single session or multiple?
They don't have to have a certain number of sessions. When they're referred for help with their lifestyle management. And people who've come once, there was one gentleman who came once and he didn't come again. And he told his primary care doctor that the people in that class knew way more than he knew. So he felt like he wasn't good for the class. And I said, oh my goodness, let him know, you can come in at any stage. I repeat the information in the nutrition lessons all the time. And so that was very interesting. But most folks who come realize that it is an ongoing class. And when we first started, I did, the We Will, you don't know, but the We Can program is based on a 12-session period, because that's what has been found to be successful for what's called moderate intensity treatment for obesity and moderate intensity treatment for diabetic lifestyle management. So we used to work on a 12-week basis and then have a little graduation. But and I still do that when we're in person, but since we've been online and the group has gotten really a smaller nuclear group, I just make sure that certain nutrition topics are covered at every 12 weeks to make sure that we talk about energy in, energy out. We talk about the components of the healthy diet with protein, the fats, and the carbohydrates, and what combinations and what percentages should be there. So I make sure that I cover certain topics every 12 weeks, but the rest of it is very innovative and follows what is needed for the group.
Okay, thank you so much.
Any other questions for Dr. Lawrence?
There's something in chat. Did you see it? Let me see.
Well, I added a couple links in the chat.
Okay.
One for the YouTube channel where people can watch the recording of this session later. I also added a link to just the Wright Center's residency website, keeping in mind that we oftentimes get students that join us for these presentations. And if they have any questions about, family medicine residency, or the Wright Center, or our program in general, you can certainly ask those questions right now. We're happy to field those questions and talk to you. Or you can follow the link and go to the Wright Center's website and learn more about the residency and fellowship programs they have available. Does anyone have any questions about residency training at this point?
Or are you all residents? And this is your night off.
No, I am an international medical graduate and I'm applying for the family medicine residency this year.
Okay.
I'm a fairly old graduate. I've been graduate for 6 years, and then I practiced medicine back in India for 4 years, and now I'm here because of my wife. So I'm excited to start my journey again.
Yes.
We have Valerie Peck attending from the Chickasaw Nation.
Nice.
Glad you could join us.
That is exciting.
All right, well, if there are no other questions for tonight, thank you for joining us. Hope you can join us again next week when Drs. Will Dixon and Catherine Najiro-Sewer will be talking about asylum evaluations. That should be a very, very good discussion next week. Until then, take care and we'll see you next time.
Thank you all for coming.